Welcome students for your first aid for all session. This session we will be trying to take up for your unit 3.1 and 3.2, which are first aid for the techniques like dressings and the bandages. So this time we will be trying to take for covering about these two techniques so that it will be easier for you. So when there is a condition for any kind of bruises or cut or any kind of bleeding, you can use this technique just to make sure you are giving as a first aider. So let's begin with what are the important things. So let's begin with what are the dressings. Just an introduction. Dressing is a very protective covering applied to a wound. So what does it do? It will usually go for a prevention of the technique, any kind of infection, absorb its discharges, control the bleeding, avoid any further injuries, and reduce the pain. An efficient dressing would be very much sterile, so we should be very much careful when we are trying to give this kind of dressing to an open wound, because if the dressing is outside or it has been contact with the air and it is not in a sterile environment, it can cause too much of problem when we are trying to put it over the wound. For example, if it is infected by the bacteria or even by any kind of microorganism, so when it comes to the in touch with the body fluid in the blood, or it with comes and the open wound where the skins are being ruptured, it can cause serious infection towards that particular wound. So hence we need to make sure the dressings or the cotton that we are using are germ free, are in a very sterile environment. Next is what are the type of dressings. So there are three types of dressings. First is adhesive dressing that is known as band-aid. Next is non-adhesive dressing, and the third one is improvised dressing. So now let's start with each one of them. I will be giving you a brief about it so that it will be an easier lesson for you to understand the importance of each. And by the end of the session, you will be knowing for this particular wound what kind of dressing will be the most appropriate one. So let's start with the adhesive band-aid or the dressing. So that is nothing but we can normally what we usually get in the over-the-counter booklet that is known as the band-aid. So band-aid, as you have seen, it is we can get it as a waterproof as well as non-waterproof as well. So here, what we find it out, let me just be a little bit elaborate in the band-aid aspect. So there are the sterile dressing which consist of an open pad of an absorbent gauze of the cellulose which is held by a place of an layer of adhesive material. The sterile adhesive dressings are supplied in a pea paper or a plastic covers. So if you can see on the band-aid, you can see in between there is a medicine, which we normally say in a layman term, that is none other than the cellulose. So the cellulose will be held closer to the wound, and the rest area will be put it over the skin area. So first and all, we have to make sure that the surroundings are very much dry, because if there, it is not too much dry, it can cause the band-aid, the adhesive area or the area which has to be stick on the skin might come out very easily. So we should make sure the surrounding skin where we are going to apply this bandage should be dry. So these are something called as band-aid look like. So which is very much common and every one of us might have used in any time in our lifetime. Next is non-adhesive dressing. They are nothing but there are three types it will be. One will be the very much which we can find it all over the counter, that is known as ready-made sterile dressing. So these dressings consist of layers of the gauze which is covered by a pad of cotton wool and with an attached roller bandages to hold it in a position. The dressing is enclosed and sealed in a protective covering and is applied in various sizes. So as the area differs, the size of this particular ready-made sterile dressings will also differs. So this is particular a gauge which in between there will be a cotton pad of wool. So why we need the cotton pad? It's just because to get all the fluid or the blood suck into it so that it will prevent the bleeding further. And just to make sure they are attached to this particular area or they are Then you hold it into the position. We use the roller bandage. They're nothing but it will be like a mesh kind of active. So these are the protective thing, and again, this also has to be very much sterile when we are using it. Next is the gouge dressing. Here there will be a layer of gouges which is commonly used for the dressing and large wounds, and they will be very much soft and absorbent. So this is liable to adhere to the wound and it may assist clotting of blood. So which we need it. Like we don't want the blood, there will be a flow of too much of bleeding, we don't need it. So that's why we use it up to clothe the bleeding. The dressing should be covered with one or more layer of the cotton wool. They will be the gouge, but we need cotton wool just to make sure these have been absorbed properly. Next is improvised dressing. So when we are not able to find the things which we need, for example, we are not able to find the cotton wool, not able to find the roller bandage or the gauze. So we have to make something just because to stop the bleeding, which is in an emergency situation at this point. So what we have to do, we have to improvise the situation that time. So that's why that came up with the name known as improvised dressing. Improvised dressings are nothing better than there will be something like handkerchief or a towel or a piece of linen or a cloth which we can use so that we can make sure that the bleeding has been stopped with the use of it. So that's why we are calling it as an improvised dressing, which are being caught on that particular time of situation. Next is how we have to look, try to make it up, apply a dressing. So this is also very much important. There are some of the places where we have to know that the techniques or the application, how we have to do it so that we will get a better climate on the bleeding control. First, you should cover a wound with the dressing as it helps to prevent the infection. Hygiene. This is always come first. As I told you in the previous slides as well, where we have discussed about the fractures or the bleeding, everything. Hygiene is the one and foremost thing which are very, very important. If you keep your hands sterile before touching the patient, that means you are very much degrading the level of germs over there. So, first and foremost, make sure your hands are clean and then you touch the patient. Even after doing all the work, make sure you are sterilizing your hands again. Either you wash with the soap or you use the alcohol based sanitizer, anything that works. So this is what. If no soaps are available, try to use any ash or alcohol based sanitizer. Can also be used and it will be effective. In case you don't have anything, try to put on the gloves which are sterile, strictly sterile. So when we are using or you can even use the clean plastic bags, but make sure they are also sterile a bit, so that in this particular case, what happened, you are not in coming in contact with the victim's blood, which is very much important because when if you, this victim bloods are coming in contact with us, again we don't know whether the patient or the victim might have the HIV or AIDS, which is not at all good if they were coming in contact with our body fluids. So we have to make sure that our safety also comes in that before making sure that other person is safe. The dressing must be covered with adequate pads of cotton wool and all extending beyond them and retaining the position by bandaging or strapping it. So this is again, you have to put it up with the help of the cotton wool, but also you have to put the bandage in a such a way that they are holded into that particular position. Now, next is bandages. Same similar to the dressing, it will be bandages also. So bandages are very long stripe of the material such as gauze to protect a place to immobilize and compress and support a wound or an injured body part. There are a number of different first aid uses of bandages. They can be used to secure a dressing, control the bleeding, support or immobilize the limb. They can reduce the pain, also control the swelling in the injured part. They are made up of flannel, calico, and the elastic net or the special paper. Next is if you have no bandage available, again you can improvise the situation. So whatever what you will do, whatever you find in and around you, try to make it as an use of a bandage. For example, if you can fold a square fabric such as head scrap diagonally to make a triangular bandage and the roller bandage if further folded. a belt, tie, or some other materials can also improvise the bandage. So at that time, whatever you can see, if you can make up into a roller bandages or a bandage, that is known as an improvised situation or the improvised bandages at that time. Bandages should be applied firm enough to keep the dressing and splint in position, but not too tight as it can cause a part of impaired circulation. A bluish tinge on the fingers or the nails can also be a danger sign. Just to know whether the person is having the circulation impaired, when you maybe you have tied a bandage and which is too tight, if you are trying to touch their feet or the hands, if you feel it is too cold or their fingers and the nails have become bluish in color, turned bluish, that means it can be due to cyanosis. Cyanosis are nothing but when they are not getting enough oxygen. Blood carries the oxygen along with them. So if the blood circulation is impaired, hence they are not getting the perfect amount of oxygen also, hence leading to the cyanosis condition. So bluish color, if you see, you can make term it as cyanosis. This is the very much important thing to know because when we are trying to put a bandage, if it is way too tight, it can again superficial who are very much found in the superficial aspect or the surface of the skin as an artery. They are easily get entrapped in between the bandages or in terms of dressing. So we have to make sure that these are not being happening. Types of bandages. So there are triangular bandages, which we call as a master bandages, and used for normally for the large dressing slings or even to immobilize the limb. Then we have roller and the crepe bandages to support the injured limb. And then we have tubular bandages. These are generally we use for the like toes or fingers just to secure that injured area. So let's take step by step of each one of them. Triangular bandages are nothing but they are made up of a cut piece of glyco around 100 centimeter square from corner to corner, giving in them a triangular bandage. There are three borders. The longest one of this one is known as base. The other two will be called as the sides. So these corners which we have, the base is called as the point, and the two other sides which we will be terming as ends. So in this triangular bandage, when you see a base, in the normal term of the medical, when we are trying to give a dressing, the base will be called as point and two sides will be called it as ends. And always the point will come first followed by the ends. So that always will be the phenomenon and the procedure when we follow put any kind of bandages. So I will be sharing with you where and all we can use the bandages and how is the process to use it the same. And we are not talking about the ref knots also. So the ref knots are nothing but whenever if you see a person hanging their hand from their neck with the help of a sling or a bandage if you can see, so that normally if it is made by hand, so handmade thing, handmade sling, so we try to put a knot. So that knot we are called as Ralph knot just because it is very easy to tighten, loosen, and even for opening purpose. So that's why we should know how to even tie that particular knot. Now let's go on to the sling. Slings are used to support the injured arm to prevent the pull by the upper limb or upper limb to injury the injure of this chest, shoulder, neck, and also to secure when splint when applied. So now let's come with the arm sling. So these all are where we usually use our triangular bandages. So the large arm slings are used in case of the injuries of the arm, wrist, hands after the application of dressing, splints, plaster cast, and the bandages. To apply an arm sling, first of all, what you need to do, face the casualty, hold the bandage point firmly. So again, base is the point. So we have to take the point firmly. Put one of the end of the spread triangular bandage over the uninjured shoulder with one point towards the elbow of the injured side. Pass the end around the neck and bring it over the injured side of the shoulder, and the other end now will be hanging down over the chest. Place the forearm horizontally around across the chest for about 90 degrees and bring the hanging end up. The forearm is now covered by the bandages. Tie the two knots ends in such a way that the forearm is horizontally or slightly tilted up, either or this way or even this way. We can put the wrist knot and place the bit over the collarbone. Hold the point with one hand and bandage at the little finger with the other. Stretch it tight to check whether any object like bangle, watches, or metal ring, etc., is beneath the bandage. In case if it is there, remove it immediately. So we don't want any kind of objects making any kind of obstacle for the bandages. Tuck the part of the sling which is loose at the end of the elbow behind the elbow, so you need to tuck that particular loose point so that it is there inside, and bring the fold to the front and pin it up in the front of the bandage. Place the free base of the bandage in such a way that the margin is just at the base of the nail of the finger, somewhere around this area, and the nails of all the fingers should be exposed. So you have to put the sling in such a way that these all areas are being exposed. Only the fingers are being exposed and the nails are exposed. Inspect the nails in to find is there any kind of bluish color again to find the cyanosis. If there any kind of cyanosis, please remove the sling, loosen it up, and then tight again. Tighten it a bit, not too much, not too tight, not too loose. Tighten, it can go for a cyanosis condition. If it is loosened, then there is no immobilization which is taken care of. A bluish color shows that there is a dangerous tightening of the splint or plaster, therefore free blood flow off is not possible. If the casualty is not wearing a coat, then we have to place some soft pad under the position of the sling over the shoulder area so that the friction is not making rubbing the skin off. And also because of the weight, it may be having different effects. So better we have to give some softening pad under the shoulder. Now let's come to the collar and cuff sling. Collar and cuff sling are used to support the wrist only. So this collar and cuff are nothing but it is only for the wrist purpose. So to apply the collar and cuff sling, we have to make sure the elbow is bent. Forearm is placed across the chest in such a way that fingers are pointing on the opposite shoulder. And in this way will be the sling will be applied. A cloth sling hinge is made with a narrow bandage. Two loops are made and held on the top of the other. The front hook is laid back behind the back of the loop without turning. A cloth hinge is passed around the wrist and then tied in the neck pit over the collarbone on the injured side, somewhat in this way. You are putting a cloth hinge here and trying to put it on the other side, uninjured side, and then one point on the injured side. And now you will bring it together, put the knot here. So this is what we call it a collar and cuff sling. Come next is a triangular sling with an underarm upward. So an triangular sling is used to support the fracture of the collarbone, arms, and or injured shoulder, and also the crushed or badly burned palms. It also keeps the hand raised given up by giving a relief from the pain due to the fracture. To apply a triangular sling, place the forearm across the chest with the fingers pointing towards the opposite shoulder. Again, it will be in the same position, touching the collarbone and palm over the breastbone. Place the open bandage over the wrist or chest with one end over the hand and point the point beyond the elbow. Tuck the base of the bandage comfortably under the forearm and hand. Fold the lower end also around the elbow, and it will take up across the back of the shoulder, which is of the uninjured side, and tie into the hollow above the collarbone by using a rough knot. Tuck the fold and form backward over the lower half of the arm and fix it with a safety pin, somewhat in this way. So you are trying to put the sling over here on the elbow area and trying to lift it up towards the uninjured side. Next is scalp bandage, something for your head. If there is an injury to your head, we'll try to take this scalp bandage up. So use an open triangular bandage This also we will use the triangular bandage only, but in a different way. Fold the narrow hem of the base of the open bandage and place it on the forehead just above the level of your eyebrows, somewhere around this area. Take the two ends of backward after placing the body of the bandage over the head and point the hanging near the nape of the neck. Cross the two ends and then take them forward above the ears to meet on the forehead where they are tied. Press on the head of the patient, draw the point firmly downward and pin it to the bandage after taking it upward. A suitable sized ring pad, also made from the triangular bandage, can be placed beneath the head bandages and an appropriate place to put pressure around any depressed fracture of the skull. So somewhat around this way. If you're trying to put the base of the triangular sling on the forehead, and the two ends will be coming up. So whatever the point is left over that area, we'll try to tuck it in the back and tie it the two ends. And this end will be left out. So what you need to do, put it up again inside the tied area. So this is how the scalp bandages are being done. Next is shoulder bandage. Use a broad bandage. Stand facing the injured side. Place the center of the open bandage on the shoulder with the point over the side, the neck reaching the ear. Carry the ends crossed after hemming the base inward around the middle of the arm and tie the knot on the outer side so that the lower border of the bandage is in fixed position. Thereafter, apply also the sling to rest the arm of the injured side in. Turn down the point of the bandage over the sling knot, draw it in tight and pin it up. So somewhat around this way. So you are trying the base over the elbow and you will just swing it up so that only the one part of the end will be up. And this is one way, and you are trying to take all the part up and swinging up to keep a right note, left note over the injured side only. This is one way of the shoulder bandages, and this is the another way. Either you can just take only the shoulder with the chest secured and immobilized and tie it up. Next is elbow bandage. Use an open triangular bandage. Bend the elbow to the right angle if feasible to do so. Sometimes if some injuries, patient won't be able to bend their elbow itself. So if it is so, then just put it to 90 degree. If not, try to take it wherever it is possible. Folding a suitable hem of the base of the triangular bandage and apply as follows. Lay the point on the back of the upper arm and the middle on the base on the back of the forearm. Cross the end in the front of the elbow and then around the arm. Tie the ends above the elbow. Turn the point down and pin it down low. When the elbow cannot be bent, you also use the roller bandage with the figure of eight technique. So if you can see the first picture, you can see the triangular bandage, how they have been tying up. So the base will be coming on their forearm and they will tie it across, and the base, the pointer which are there left out here will be, first they will tie the both ends and this will be coming out here and try to put it under the knot. In this is nothing but a very much significant and very commonly used figure of eight method, which are being used for the elbow, even for the ankle joint or the knee joint. We can use this particular and a figure of eight. Nothing but the roller bandage should go overlapping with each other in the figure of eight manner. Next up is the roller bandages. Roller bandages are used in the hospital and the first aid post. They are made out of cotton material with a loose mesh, and there are various length and width. For various other size and shape, and thus areas also differ. Like for example, if you're talking about a finger, the roller bandages will be smaller in size. And if you're talking about a bigger joints, maybe just take a, for example of knee, they will use a bigger roller bandages. So if for fingers in centimeter, the width will be 2 centimeter, in inch it will be 1 inch. Hand will be in 5 centimeter or 2 inches. Arm, it will be 5 or 6 centimeter or 2 or 2.5 inches. Leg, it will be 7.5 or 9 centimeter. In inches, it will be 3 to 3.5. Trunk, it will be 10 to or 15. And in this width, will be in inches, it will be 4 to 6 inches. So as I told, depending upon the areas, the width also size and width of the roller bandage will also varies. The roller bandages are also meant to keep dressing in position. The rolled part are called as drum or head, and unrolled part is known as the tail. So that whenever we are trying to put the roller bandage, as I told you before, it should be just applied firmly and evenly. It should not be too tight or too loose. To apply roller bandage, always face the patient. Keep the tail of the bandage towards the patient and the head towards you. When the bandaging left limb, hold the head of the bandage on the right side of the thing, or vice versa. When you apply the counter surface of the bandage over the pad, wind it around in the injury twice so it is firm. And you are helping with the reduction of the bleeding as well. Bandage from the below upward over the limb also make it a rule to apply the bandage from the inner side to the outer side. Check out the bandage if it is neither loose or neither too tight. Roll the bandage so that each layer covers with two-thirds of the earlier. Fix the bandage by even putting up the pin will be even more secured. Sling or the simple spiral. The roller bandage is applied in a simple spiral form. So if they are just called these bandage, then we are round in a spiral. Reversal spiral. So it will be even coming up reverse downward in each side. So it has to be varies in the thickness if it is leg or forearm. Figure of 8 will be something like this. So where we are alternatively going loops around like make a figure of 8. I hope students this was very much informative session for you. For the next time whenever you see any kind of patient which need a dressing, please approach them with an appropriate amount of dressing and which bandages or the dressing technique we will choose. Thank you so much.